Hi, I'm Dr. Mark Pitel. I'm a dentist in Poughkeepsie, New York, and I'm also an associate professor of clinical dentistry at Columbia University College of Dental Medicine. I've been in practice for 36 years in 4 states, and I'm here today to talk to you about a new innovative product in the world of glass ionomers. For those of you who have been using composites and been focusing on that as your primary, direct aesthetic material and haven't taken advantage of the use of glass ionomer materials, you're really missing something. For those who have been using glass ionomers but may have been frustrated with using the capsules and the mixers to get the material dispensed and in use, I think you're going to find this new application of the Fuji Automix LC cartridge a real help to your practices. For those that are using Fuji cements in these cartridges, this is going to be a natural for you. Essentially, the mixer that you get basically allows you to use these interchangeable cartridges. They're loaded, and you have the disposable mix tips that are placed on. You place the lock on and you're ready to go. There's no mixing with a capsule mixer. There's basically no limitation to the amount of material. So it should make your life very, very easy in terms of using glass ionomers if you already use them. You have a new way to do it. If you haven't been involved with glass ionomers, then it gives you a way to get in without having to apply a cavity capsule mixer. The one thing that this is really nice about is because it is a resin-modified glass ionomer, is that you can now do sandwich restorations with these, and you can combine the composite, your favorite composite material, as a surface material and use this as a base. And again, you get the advantage, because it's dual cured, of being able to light cure it, and it gets very set. This particular material also has smaller particle sizes, so it polishes better, is smoother, and has enhanced fluoride release. So the way that I actually like to use this material clinically, keeping in mind that it is a dual cured material, it has a 2-minute working time, has a 20-second cure for the light part of it, but clinically I like to use it in this way. When I will dispense it into the cavity, it's very wet and has a very, very low viscosity at that point. So I actually like to wait until the viscosity gets a little thicker, and then I can take a plastic instrument and adapt it very well, the material very well, to the cavity and the margins and everything where I need to adapt it. And then once I've adapted it, then I light cure it. So we get the benefits of both the glass ionomer cure plus the light cure. And that is the way the manufacturer recommends it to be done, so that you use the light cure, and the resin will actually protect the glass ionomer while the glass ionomer is fully setting. So in summary, hopefully you'll find this material to be as exciting as I do, and you'll find that you really enjoy it for use in your practices. Have some fun, go out and use glass ionomers.